Are the Trump administration's Medicaid cuts really addressing fraud and abuse? Some are now saying that's not the case. There have been mixed messages as to what this so-called big, beautiful bill does to Medicaid. So tonight, we speak with a researcher who's been digging deeper into what he calls the, quote, scorekeeper's account, or the Congressional Budget Office of Medicaid changes.
Unfortunately, there is fraud in Medicaid and Medicare.
Andy Schneider is a research professor at the Georgetown University McCourt School of Public Policy and has been digging deep into Medicaid proposals in the so-called big, beautiful bill.
CBO thinks as a result of this, nearly 8 million people are going to end up uninsured.
That's by 2034, the Trump administration and its allies in Congress saying those who need insurance will still get it, saving nearly $1 trillion in the process.
Yeah, the Democrats have it wrong. Yeah. Waste, fraud, and abuse. In fact, if you look at what's gone on, we've gone way back. We take care of Medicaid, we take care of Medicare.
This bill protects Medicaid, as I laid out for you, for those who truly deserve this program. Democrats like Paul Tonko said they never got to see evidence of fraud being addressed.
Is it true? Did they ever show the abuse? You know, there was never an address of abuse, waste, and fraud. What they did, Tom, was cut programs, discard the programs. They never fixed them. They never said, okay, here's the more efficient outcome. The efficiency, the waste, the fraud was never addressed. It was just outright denial of programs.
According to Schneider, Tonko has a point.
There are 21 different provisions. 4 of those, in my judgment, have to do with fraud and abuse in Medicaid. I don't think it's an attempt to deal with waste, fraud, and abuse.
Refined work requirements are also included here.
I don't think a lot of people understand how important it's going to be to move people that shouldn't have been on Medicaid in the first place, the fully able-bodied who are sitting on Medicaid turning down work. They're going to be going to get work.
But Schneider points to the administrative costs and red tape burdens of the program passed on to the states and companies, especially when it comes to work requirements, saying that will be where the most people lose coverage.
Georgia experienced very high administrative costs. Very high administrative costs, very few people getting enrolled, and you know, so far we can't figure out whether anybody's working as a result.
Republicans argue doubling hospital funding through the Medicaid transition period will help fill the void. A deeper look at our conversation with Schneider is coming up at 10:30.